Today's guest, who has a lot of experience with cataract surgery, Dr. Natasha Herz is an ophthalmologist who practices here in Maryland. We see cataracts in the eyes of our cats and dogs, and if we live long enough, we will all get cataracts too. So it's good for us to know just what a cataract is. So here's Dr. Herz to explain.
A cataract is when the lens inside the eye starts to get a little cloudy, which is mostly an aging change of the lens. And if you think of the eye like a camera, the lens sits behind the pupil in the eye, and it focuses the image and the light that comes through the pupil onto the retina. And so it's the main focusing part of the eye.
Okay. And what happens when there's a cataract?
So cataracts most typically start somewhere in your early to mid-50s, which at that point it's a very mild haze that has developed in the lens, and gradually then develops over time. Usually it can be 20 to 30 years before it's fully developed and cloudy enough to impair the vision.
And why do you get that cloud? What causes it?
So it is mostly an aging change of the lens, but there are other things that can make cataracts form, and some of them make them form more quickly than others. But number one, risk factor being age. Number two, smoking. Number three, and maybe not necessarily in this order after that, but systemic disease such as diabetes can make them form faster. And medicines like steroids make them grow faster. And the most potent cataract formation is caused by steroid eye drops, but also steroid pills like prednisone, or inhaled ones, or even topical ones, but that is the least common to get it from a topical steroid. They have to be applied directly near the eye for that to increase cataract formation.
So those are the things that would make it more rapid. Is there anything we can do to slow its progression?
So that's a good question. A lot of people ask me that. I didn't mention with my list before, but UV exposure over your lifetime does make a difference, because if somebody has worked outdoors, I will see their cataracts form much earlier than the average person. But wearing then glasses with UV protection in them, UVA, UVB, as well as then eating a lot of green leafy vegetables, a lot of antioxidants, because that helps to combat aging changes. But it does really help to decrease the rate of cataract formation.
Mm-hmm. Now you talked about the maturation of the cataract, that it takes time. Is there a best time to treat cataracts? Do you usually wait for a while? How do you tell when it's time to treat?
So the classic question is always, when is my cataract ripe? You know, when's it ready to take out? And the answer is that since there is a long maturation period often, you don't do anything for them other than trying to stay healthy. Otherwise, eat your green leafy vegetables and wear your UV protection. And there's no medical treatment otherwise. But when they are cloudy enough that they impair your vision and keep you from being able to see well enough to read, well enough to drive, in spite of the best glasses we can give you, then it's time to take them out. And typically, the average American is 75 when that happens. And when I give a cataract rating as far as like how cloudy it is, I'll say it's about a 3 out of 4, that kind of clouding rate. And that's typically at the point where it's making their vision 20/30 or worse.
And that's when you'd be saying it's time to operate. Why do you wait that long?
Well, because there is a long period of time where cataracts don't affect the vision at all. And so first, do no harm. So it's not where, even though the cataract surgery is very successful, it's the most successful procedure in the United States done. It's done, most commonly done as procedure, as well as very successful. There's less than a 1% risk of a complication such as infection or some kind of instance where some of the cataract got left behind. So it's a very successful procedure, and people usually see well enough to drive even the next day after the procedure. So
amazing.
But you don't do it unless it's really impairing the vision.
Right. So just because of those risks, you'd always wait and have a really good reason for doing it. So I want to know, we're watching this video of cataract surgery. How do you keep your hands so still?
Well, some of that, I suppose, has to just be natural, but there's some tricks.
Really? Okay.
But you do have to be relaxed when you do it, because if you're tense, it makes you shake.
Makes you
and then
shake,
there's some
that's
ways
true.
of just positioning yourself to keep from shaking.
Well, it's just amazing to watch. Now, tell us, we're about to see the lens put in. So you take the kind of the broken lens out and you replace it with an implant. How do you decide? Do implants come in different shapes and sizes? How do you decide what you're going to use to replace a person's lens?
Well, so we measure everybody's eye a couple of weeks prior to the surgery for the right power of lens implant to put in. And that's because we have the opportunity, when we are replacing your lens, to also correct for nearsighted or farsightedness or even astigmatism. And there's some implants, they call them premium lens implants, but that also have computer and reading prescription built into them. And I brought some examples. Now, these are about 10 times at least bigger than what really goes in your eye, so don't get too concerned about it. But that's what a standard implant looks like. It's made out of a foldable acrylic material so that it can be folded sort of into a little taco shape and then inserted through a small incision, like 2 millimeters in size, and then through the pupil, and then once it gets back behind the pupil, it opens up, and the same structures that held your natural lens in place will hold the new implant in place. And this was an example of the premium lens that has both the distance as well as computer and reading built into it. And you can see there's concentric rings of power in that central optic, as opposed to just one power throughout the monofocal lens there.
And so this would mean that when you get your cataracts done, you also can throw away your reading glasses.
Yes, if you were a good candidate for this, you would be able to do almost every task without your glasses.
So that's fantastic. Well, that's good news about aging, isn't it?
That's
Getting
true. I do try to reassure my patients. It sounds scary to have your eye operated on. However, there are some wonderful things that I can do for you once it's time. And sometimes once they get a hold of the fact that they could get rid of their reading glasses, then they're begging me to take their cataracts out even when they're not ready.